Welcome back to Therani. I'm Joe B. Have you ever wondered what are the 3 best manual therapies to improve extension after knee replacement? Let's dive in. After a knee joint replacement, most of the time, the patient will have a limitation of motion towards knee extension. The post-operative swelling can result to disruption of the reverse screw-home mechanics, where the tibia glides anteriorly and externally rotates during knee extension, while the patella glides superiorly. So the faulty mechanics will lie in the fact that the tibia can be stuck posteriorly and internally rotated. The femoral condyles posteriorly rolls and externally rotated, while the patella is stuck inferiorly. To assess limitation of motion of knee extension post-surgery, the patient will complain of stiffness towards knee extension with confirmed limitation of motion during goniometric measurements and limited hip and knee motion during the swing phase of gait. To improve knee bending, a combination of joint and soft tissue manual therapies can significantly improve range of motion. Less is more when doing mobilizations after knee replacement to avoid too much swelling that can further reduce knee extension. Start with a tibial anterior glide mobilization, since moving a larger bone joint can positively influence the smaller joints surrounding it. Patient position in supine with treated right lower extremity close to the edge of the table, and the therapist's right hand at the patient's heel, while the therapist's left hand on the distal anterior thigh, just above the patellar base. From there, the left hand pushes the right thigh towards the floor, while the right hand and forearm turns the tibia laterally for terminal external rotation mobilization. Mobilization grade progression can vary from grades 3 to 4, or mobilizing up to or at the limit of the range, as long as your patient tolerates. Each mobilization is held for 3 repetitions of 30 seconds, and the bony model looks like this. After that, you can proceed to superior patellar mobilization, where the patient is positioned in supine with the right lower extremity close to the edge of the table. The therapist will be on that side with the right hand first dorsal web space at the patellar apex, reinforced by the left hand. From there, therapist glides the patella superiorly with grade progression varying from grades 3 to 4, or mobilizing up to or at the limit of the range, as long as the patient tolerates. Mobilization is held for 3 reps for 30 seconds each. And here's what it looks like. Finally, a hamstring release can be performed in prone, but with both knees flexed with pillow under the legs and rolled towel under the distal thighs to keep the scar off the table if it's tender. The therapist will be at the treated side with the right hand stabilizing the distal leg, while the left ulnar border of the forearm strokes the hamstrings from its distal insertion to its origin. A grapeseed or fractionated coconut oil or a hypoallergenic massage cream can be used to reduce friction. This is done for 15 to 30 slow strokes. These manual therapies will need to be routinely performed for 3 to 5 sessions, and then monitor the response to determine if you will need to continue on. Guys, for handmade apparels and accessories, please visit Zenvibe Clothing. They have exclusive designs and other clothing stuffs. If you visit Zenvibe Clothing and key in Anani 3D 20% off or Theranimation 20% off, then you will be able to avail that particular discount. Thank you, Zenvibe Clothing. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.